Tracey Stroup, and I'll be your next presenter as we work into what we call functional blood work, which is a course that I created called Beyond the Blood Work. So I wanted to make this as easy as possible for people who are looking to take their health back and be a little bit more independent on when they have blood work, when they're seeking out blood work from a practitioner, and they know they don't feel well, but the numbers are falling into what we call normal ranges. I think it's really important that we understand where blood work came from, that there's a difference in terminology when it comes to functional blood work, where your levels and numbers are within a functional range so your body can heal, versus this general term called normal. So I'm really excited to be here at the World of Wellness presenting this, and I am going to talk about a few solutions as we move along that you can get today. Additionally, there is a course that people can take. It's a little bit higher level, but if you want to take it and kind of learn how to take your health back, it's absolutely essential. One of the things that I always talk about is health freedom. You know, the words medical freedom don't really jive for me. I'm a doctor of traditional naturopathy, so I've never really been bound to a licensing system or a system within the medical system. And I'm not discrediting the medical system. I think it's wonderful. I think for acute trauma, you need a surgery, you have a heart attack, you have to go to the emergency room. That is what it's there for. But we have let go of our ability and our power to really take our health back and understand what is happening in our own individual bodies and how to do things before it gets to an acute catastrophic state. So I hope that what we learn and share today is beneficial to you so that you can take at least one step in understanding a baseline blood panel without all these confusing numbers that you don't know what's happening. And for yourself, your family, and even if you're a clinician, a healthcare professional, this can revolutionize your practice. One of the things that I see in the industry is massive over testing. You know, it's like you go to see a practitioner and you have to get test after test after test. And while those tests are valuable, you can see a lot in a baseline blood panel that will give you more insight to your overall health than, you know, just testing and testing and spending tons of money. Sometimes that testing is necessary, but what we're going to learn today is going to kind of change the way you look at blood work. So I hope it's beneficial. So if you have your blood work on a portal on your phone and you're sitting in the audience, you know, you can pull that up. Just pull up your app or whatever it is you have. If you're at home and you want to come back and watch this again, we're going to be talking about the CBC with differential today, which is the complete blood count with differential. And you can go back and take your blood work and listen to this lecture again and compare it. Like I said, I'm going to offer some solutions, but this is in no way to cure, treat, or diagnose any disease because I really don't believe in disease. I believe that the body is expressing physical discernment based on something that you're deficient in or something that's in the way that's creating a toxicity. And so your physical expression of that is going to look like symptomology. And I think for far too long, we have been in the repression therapy. If you don't feel well, you're suffering, we just repress that symptom and we don't really understand why your body's expressing it. You know, and as a Christian personally, and I think the life is in the blood, as the Bible says, I'm going to listen to what God says and go back and try to figure this out. So, Phil, do you want to bring up the PowerPoint for me, please? All right, next slide. So just a little bit about me. I am the vice president of a tech company called GetHealthy.store, actually, and we create branded stores for doctors. And we work very closely with World of Wellness and also Nutritional Frontiers, which happens to be our #1 selling brand. So we're very proud of that relationship. I'm also a naturopathic doctor, and I've been in the health and wellness industry for about 21 years. So obviously I started so young. But I started off as a personal trainer. I have a bachelor's of science in exercise and sports science from Penn State University. And I really loved fitness, loved health and wellness. And when I had my first son, he had some issues with skin that, you know, my personal training degree didn't satisfy. So I went back to school to help my family initially. And then I loved it so much and I wanted to help everybody else because I saw such tremendous results. So as Dr. Orbach was saying in the last lecture, you know, it takes a village of all of us coming together, utilizing our skill sets and applying them to each individual. And then it takes us teaching you as people to apply those to yourselves. So lots of other things that I went through: level 2 digestive specialist. I am a natural business consultant. I help practitioners learn how to set up their businesses, what formulas such as nutritional frontiers to come into. I've been in the industry, like I said, a long time, but most importantly, I'm a wife, mom, and I'm a lover of Jesus. So next slide, Phil. All right, so let's talk about the history of blood work. I mean, many people don't know that blood work is a compilation of results from a wide variety of people. And who were these people? They were basically people that were in the hospital getting blood work. So they were sick. I don't know about you, but many people will go to their PCP when they don't feel well. It's a very low percentage of people that actually go for their yearly just to get a checkup until you hit a certain age. It tends to be older people that do that after the age of 60 versus what we really need to talk about is preventative health and going earlier to get this blood work and then really knowing how to look at it and utilize it. So there's all of these ranges on this blood work that are called normal. And normal for you may be abnormal for me or not functional for me. In case in point, let's just talk about one that everybody knows. Thyroid gets checked a lot with women, especially. And I do believe it should be checked with men, but it's not as heavily emphasized. However, a normal range with thyroid can be 0.45 or 5.5, depending on what blood work lab you're going to 4.5 to 5. So 0.45 to 4.5 or zero point 0.5 to 5.0. So it's a really broad range. And thyroid stimulating hormone isn't even a hormone produced by the thyroid. It's produced by the pituitary. So you have this massive disconnect of like, how does it actually impact? Well, some of my clients feel really good when their thyroid levels or TSH levels are actually at like 1.69, where other clients of mine don't feel well there. So I always say normal is like a 4-lane highway. You know, you have traffic coming one way, traffic going the other, but functional is actually staying in your own lane. It's being able to go from point A to point B at a speed that your body is comfortable in and staying with your own lane, not disrupting the other traffic or other traffic disrupting you. So we really want to take the word normal out of our vocabulary when it comes to blood work as people and as practitioners. Functional is where it's at. And you cannot heal thyself if your blood work is not in a functional range. And what I normally tell my clients is if your levels, whatever we're looking at, is outside of the range of functional, when we finally get them into that functional range, that's when your body starts to heal. So it takes time to heal. It takes effort to heal. It's easy to get sick. It's hard to get healthy. So I want to just position this today with a little bit of, I guess, hope and inspiration. Number one, if you're suffering with something that you know is there, but everybody keeps dismissing you and saying, oh, your blood work is normal, maybe you're depressed. I will tell you, laying new eyes on this old analysis is going to be so inspiring to you. Second, it takes time to heal. You know, I always tell people Jesus can heal in a word or in time. And I don't know what that walk looks like for you, but I'm here to walk it with you. And so when we look at the healing process, we've been brainwashed or indoctrinated to think that it should be instantaneous because we're so used to the symptom repression. And guys, as Dr. Sherry Tenpenny once said, symptom free in the presence of pharmaceuticals is not health, it's just repression. So you're still sick, you just don't know it anymore. So I want to learn today and teach you today about these functional ranges just in the CBC. And we're going to go over what is complete blood count and all of that, just so you understand. And then we're going to take a look at your own blood work if you have it there. All right, next slide. Okay, so on blood work tests, if you've looked at them, there's all kinds of abbreviations of measurement. There can be a metric system or others. But if you look at this, most blood work that you get from your PCP or from the hospital, they're going to have similar values. Where they don't, I'm going to show you how to do the conversions later. So you're going to have a little cheat sheet that looks like this that you can go out with. That's really going to help you lay new eyes on an old testing. Next slide. All right. So A baseline blood panel, which is very typical if you go to your PCP every year to get a physical, or if someone's doing a blood draw on you, is going to be made up of four different components. One is the complete blood count with differential, or what we know as the CBC with differential. The second one is called the comprehensive metabolic panel. The third one is a lipid panel. That's your cholesterol panel. And poor little cholesterol, everybody demonizes him. So actually, he's good. And if you take the course, you'll find out how he works, and why he's so valuable, and what it means when he's not in balance. So it doesn't necessarily mean cardiovascular disease all the time, but I digress. And then there's a serum iron, which I run on people because iron is in every cell in the body. So it's a vital mineral, and we seem to just push it aside and discredit it when we know that most kids are iron deficient, women tend to be iron deficient, and anemia is still a problem in our society. So these are the four panels that I like to see. They're probably the most common, and this is what you'll see when your doctor draws blood or does blood work for you. These are the four components that you'll look at. Next slide. All right, so what is the complete blood count and what does it show me? Well, the complete blood count, or CBC, is a concentrate of three blood types: white blood cells, which we know as immune cells, but they are blood cells; red blood cells; and then platelets. And what they do is, by measuring the volume of these blood cells, the CBC can show the doctor how to evaluate your overall health and especially what your immune system is doing. For me, when I look at this, I'm looking at methylation issues, iron need, underlying instigators such as viruses or bacteria that are laying latent in functional ranges, not normal, because we're no longer looking at normal. And when we look at this CBC with differential, you're going to see my ranges are so much tighter because I think we have to narrow our focus a little bit on this. It also tells me a lot about your blood viscosity, nitric oxide levels, gut health. So I'm going to talk about formulas in the immune category, but also in the circulation category, in the methylation category, and in the mineral category. All of that from just a simple, literally, probably at max $10 test out of pocket. And I'm just going to pause here to say this. You don't need a doctor to prescribe you blood work. You may walk into any LabCorp or Quest lab in your area and request a CBC with differential, comprehensive metabolic, lipid panel, or cholesterol panel. You will pay out of pocket for it, most likely. But honestly, those four tests in conjunction may cost you $60 to $80, depending on where you go. Now, to get all of this information for that amount of money is amazing. And I want to also just address this. It's really important for you to understand that if you invest in your health now, it's going to prolong the payment of disease later. So I want you to really think about where you're putting your money today. I know that you can walk around and you want discounts on everything, but your health is valuable before you get sick. You shouldn't wait for dis-ease for you to put a value on your health, because I assure you it's going to be harder for you to get out of it. So if you learn anything today, it's two things. One, you should be able to look at the test that your doctor prescribes you and be able to put eyes on it and apply it to your own functional levels. And number two, your health is valuable enough for you to spend money on it before you're sick. So I hope that's what you take out of this, if anything else. Next slide. All right, comprehensive metabolic panel. This is a test that shows the glucose levels, your fluid levels, electrolyte levels. Also, for me, it's going to show kidney function, gut integrity. I can tell if somebody has leaky gut just by a comprehensive metabolic panel, which most people look at for liver. But it shows you kidney function. It shows you glucose levels. It shows you if your body's utilizing energy. It also will tell me so much about your adrenal health and your amino acid need. And people are like, well, what do I care about amino acids? Well, amino acids, the 22 essential, they are like the vowels in the words of communication in your body. So I always joke around and say, if you don't have your vowels, your body's speaking Hebrew. And if you don't know Hebrew, because it doesn't have any vowels, then your body doesn't really know what it's trying to say. So it's really important that deficiencies are filled when we're looking at this blood work, which is what we should be looking at it for, not just for diagnostic purposes, which isn't how I use blood work. I look at it to say, okay, what potholes need filled in your roads of communication? What bridges need built? And what carnage do we need to move out of the way so your roads are smooth and clear? So comprehensive metabolic panel, part of the baseline, really good information. Next slide. All right, lipid panel. This consists of a couple various tests, but it shows you triglycerides and your cholesterol. This will also show me how well your body is balancing hormones, how effective it is at building brain, and also vascular integrity. It's not just cardiovascular, guys. Cholesterol has so many roles in the body, from patching things that are leaking to neurotransmitter production. And neurotransmitters are brain hormones. All hormones are hormones. It's just one are endocrine, sex hormones, or stress hormones. The other hormones are brain hormones. So when you're taking cholesterol away, you're literally, when you suppress it with a drug, you're literally suppressing your ability to balance hormones, make new brain, and patch your vascular integrity. Now, do we want it running rampant in your blood? Absolutely not. Am I telling you to stop any medication today? Absolutely not. I can't tell you to stop any medication. That's between you and your doctor. However, I am asking you to learn so you can ask better questions. And sometimes by asking these questions, you have an opportunity to teach. So everybody can learn from everybody else. We are not on an island of knowledge where we know everything. And I certainly don't know everything. So the other thing I want to point out is triglycerides. This is one glycerol with 3 fatty acids hung to it. So there's 2 forms of energy in the body. One is carbohydrates, that's immediate energy. The second one are fatty acids, and your cells need fatty acids. They are surrounded by a lipid bilayer. Cholesterol is going to come out from the liver like a boat. LDL, low density lipoprotein. That is not a bad cholesterol. He's just full of cholesterol. He's actually not a cholesterol at all. He's a fat molecule with a protein stuck to it. It's called a low density lipo, meaning protein, right? Meaning fat, protein, meaning protein. So lipo, fat, protein. So it's this conjunction together that acts like a boat, carries out cholesterol, fat soluble vitamins, and triglycerides in the boat. And as that boat's traveling through your bloodstream, he's dumping out things that your cells are asking for. They're asking for triglycerides because they need energy. They need fatty acids. They're asking for cholesterol to patch something. And they're asking for fat soluble vitamins like A, E, D, and K. Then your HDL, what they consider good cholesterol, but now we know both are good and useful. He's a tugboat. He's going to come out and he's going to tugboat back everything to the liver. At that point, your cholesterol is going to be used to build hormones and neurotransmitters. So if you have high cholesterol in your blood or high LDLs, it just means that your tugboats are not going back to the liver. And we have to figure out why. And it's not because your grandmother's sister's brother had high cholesterol. That's not true. You probably just grew up in the same environment as your dad, as your mom, and other people in your family that had high cholesterol. And your cellular inflammation is probably too high for your receptor sites to grab the good things from cholesterol and from the LDLs. So more of that in the blood work class. Next slide. All right, serum iron panel. Obviously, it is what it is. We look at total iron. We look at ferritin, which is your storage of iron. And then I'm also looking at, are you getting iron from storage into your cells, which I can see on the CBC with differential, which we're going to cover next. So iron is extremely important. And here's the other thing I'll tell you. Iron is a mineral. It's also a metal. So when we hear about heavy metals and heavy metal cleanses, if your practitioner isn't balancing your minerals when they're looking at metals, then you're with the wrong person. And I'm just saying that with all due respect. So metals and minerals are metals. They're all metals. Lead, cadmium, aluminum, mercury. You can say any other metal you want versus iron, selenium, zinc. They're all minerals. And they all compete for receptor sites on your cells. If your minerals that are good, iron, selenium, zinc, things like that, are low, then your metals that aren't beneficial to you are going to bind to the receptor sites and you're going to look like you have heavy metal issues. So it's really about optimizing mineral levels, not doing extreme detoxes without amplifying mineral levels. So again, I'm going to be talking about all different things today. But iron at the key, at the base, is in every cell. It's a conductor. You need it. So we have to optimize it. All right, next slide, Phil. Next slide. I think we can go past that. All right, so this is the class. If you want to take your phones and scan it real quick, or you want to take a screenshot and come back to it later, that's fine. We can also make this available probably after the lecture, Phil, and let people scan if they want to do the class. What I'll say is it's worth your investment. You're going to learn so much about your blood work and so much about your health. So we'll come back to this. Don't panic, but I want to get into the CBC with differential so that we can all learn together. All right. Okay. So it's okay. We can probably blow it up and then move it. And let's just blow it up so that everybody can see it. And we'll get to the solution. That's fine. It looks good, Phil. Thank you. All right. So this is a CBC with differential, complete blood count with differential. And what does the differential mean? Well, as you can see at the very top, it says white blood cell count, right? WBC. That is a total of your white blood cells. That's going to show us your immune system function. It's going to show us if you have an acute or chronic infection going on. Doctors use this to diagnose different things. But your differentials will differentiate what the white blood cells are trying to go after. So I always order a differential for people. I think it's really important. So I'm going to walk through what these are and the levels and why I think they're so important. So white blood cell count, as you can see, the functional range that I have listed is 5 to 8. Now, why do I have it so small? Because I don't want any instigators in there. And here's the other thing. If I say it looks like you have an instigating underlying virus that might have been activated, that basically means that there's something stimulating your immune system. It's not going to be high enough to be diagnostic with a medical practitioner as a disease, but it's just one more contributor. So let's look at instigators in our life, right? We know that poor food choices can contribute to dis-ease of the body. Chemicals that are not beneficial, additives, preservatives, glyphosate, poor thoughts, negative people, anything is communication to our body. So it's not outside the realm to say that if we have a functional level between 5 and 8 and you're below it or above it, that something's bothering your immune system. That's actually pretty much common sense. So less than 5, you're looking at something that's been there for a while, what I would call chronic. A virus, bacteria, something in your blood that your body's trying to fight. And it can even be an antigen from leaky gut that's leaking into your digestive, out of your digestive system into your blood, like a protein. Above 8 is going to be something acute. Now, you can use white blood cell counts, which they'll draw if you go to the doctors and you have a bladder infection. Your white blood cell count is going to be high because it's an acute infection. So below 5, something chronic. Above 8, something acute. Does that mean it's the end for you? Absolutely not. It's not the end. What it does mean is that we can make better decisions as to what do we do. So when I look at this first, I'm going to walk through it and we'll come back to the solutions because I think it's easier to kind of get a gauge on how many of each are necessary in order for me to do something. So let's say, for example, your white blood cell count is 3.5. You look back, and I love patterns. I like to go back through patterns of blood work, like what was your white blood cell count last year? What was it the year before that? And then, move forward from there. So if it's always been a little bit low, then you always know something has been there just instigating your immune system and keeping it distracted and busy and maybe depleting your energy and your stores of iron. And so you don't really feel well. You just have this underlying kind of like malaise of like, I just don't feel well. So you go to the doctor and it's in a normal range because this is far below the normal range. And he says, maybe you're depressed. So what I'm here to tell you today is that anything can contribute to lack of energy. Anything can contribute to usage of your stores of minerals and nutrients. And if you don't have enough good gasoline in your car, your body's not going to be able to overcome. So I'm going to come back to white blood cell count because it's first on the list. I wanted to mention it, but let's go into red blood cells, hemoglobin, hematocrit. So your red blood cells, your red blood cell count, or what we call RBC, is your body's ability to carry oxygen to tissues throughout your body. So when you have a red blood cell count that's too low, your oxygen carrying potential goes down. So you can feel fatigue because we know that you can live days without food, you can live days without water, but you can only live minutes without oxygen. So when your red blood cell count is low and your oxygen is not getting to the cells, or you don't have enough, then you're going to feel fatigue. You're going to even maybe feel a little bit of respiratory distress, discoloration of the fingertips. You might get circulation issues because oxygen's not getting to the cells. If your RBCs are too high, that's also an issue of oxygen delivery to the cells. So you might have enough red blood cells, but they're not being utilized oxygenation wise into the cells where they need to go. And it might be because there's too many and they're crowding, and that can cause an issue too. So I also have different variations for female and male. And the reason for that is because men have more muscle mass than women. And it's really important that, we do differentiate by hormones, biological sex. Not going to get into that debate, but two genders that are out there. And when people come to me, I need to know because it does make a difference. So with that said, when you're too low, it's an iron deficiency. When you're too high, it's a methylation issue. And I'm not saying you're anemic. I'm just saying you don't have enough available iron in your blood to feed your red blood cells so that they can saturate your tissue with oxygen. And so what do? Well, it's very simple. If you look to the right, I give you the support system. So Easy Iron is such an easy way to take it. It's a ferroshell iron. It's beautiful. It's not going to cause constipation. It's a patented trademark type of iron. So highly bioavailable, works super well with people. I usually tell people, do it for a month, go back and pay $10 and get another CBC, and let's see where you are. Usually they're feeling better, they have more energy, they love it, they feel great. If you don't want to take iron, you can do something like the Women's Complete or the Frontier Men's Complete. Both are going to help with methylation and the driving of iron. The Women's Complete also has the ferroshell in it. So guys, yes, you can take it as well. You can just cross out the WO and just leave it as Men's Complete if you want. So as Joe Messina always says, it's strong enough for a man, but made for a woman. So that is easy to do. Super B Complete is another thing that you can do if you're too high on your red blood cell count. That too is going to be a methylation issue. So all of these things you can add in conjunction. If you're too high and you want to balance methylation first, you can do the multivitamin or the Super B. If you're too low in iron, you can do the ferroshell or the Women's Complete, and both will actually help drive up those available iron deposits so that your body can utilize it. Now, if we look at hemoglobin, hemoglobin, hematocrit, et cetera, all the way down, you'll see that the same comments are there. Too low, you're going to have iron need. Too high is a methylation need. Just real quick, so you know what hemoglobin is. Excuse me. Hemoglobin is actually a protein that's contained within the red blood cells. So when that starts to get low, it's usually the number one indicator that you need iron. Hematocrit is a saturation. It's the proportion of blood that's made up of your red blood cells. So it's like your blood is like plasma and white blood cells. But the saturation of red blood cells in there, basically, it just tells you how many. So when your red blood cells start to die off, your hematocrit's going to go down. When there's too many and they're not giving their oxygen away and making cells healthy, they kind of just stay around because they don't know what else to do. So it's really important that we get these nutrients in and we start to optimize our health. And then as we move down, the mean corpus value, the MCV, this is the average volume of red blood cells. Again, too low, iron need, too high, methylation, because it's the same. As your saturation of red blood cells go down, that number is going to change and also go down. So the saturation is going to go down. The mean corpus hemoglobin, which is MCH, that's the next one that you see there. This is the average amount of hemoglobin in the blood. So my point is you can go and you can look up like what does every letter mean with this blood work. But overall, I wanted you to see the comments that it's actually a really easy fix if you're not feeling well and your numbers are falling below what I say is functional versus what is actually normal. And then implementing some easy strategies like a great multivitamin like Women's Complete or Frontier Men's Complete, or some good B vitamins if it's a methylation issue, which that's not atypical. We all have methylation issues if you live on this earth. I always tell people if you can't sleep or you're stressed out, then absolutely you're going to have methylation issues. And that's pretty much the majority of everybody we know. But if you also have an MTHFR mutation, then that's also a reason that you need to really be looking at healthy B vitamins, B vitamin levels. because it's super, super important that we biohack around that mutation so that chronic illness doesn't happen later. And there's lots of studies on high homocysteine levels, which is a result of an MTHFR mutation that can create chronic issues, chronic disease. So it's not opinion, it's scientific fact. We want to address a simple CBC and put solutions in. All right, let's scroll on down, Phil. Okay, so stay at platelets. All right, RDW, red blood cell distribution, and platelets. Now, during the pandemic and then after the what was called the jabby jab came out, we saw a lot of things happening with blood thickening, saturation levels that were too high. And platelets, what many people don't know about platelets are they're small, tiny cells that actually help the blood clot. So if you cut your arm, there's a process, it's an immune process. So when you cut your arm, your body actually sends platelets to the area to coagulate the blood and clot it. So when your body is making extra platelets and your blood is getting thick and coagulated, it's an immune issue. It's an immune issue. It's not necessarily a cardiovascular issue. So if we're talking about the CBC, the complete blood count that tells me about your immune system, this is why the platelets are on there. So if you have thick, sticky blood like this, and your platelet counts are high, first you got to find out why. And we're going to look at neutrophils, monocytes, lymphocytes, basophils as to maybe why. Also, we need to look at the fact that maybe you have repair issue and your body's responding. Because what is immunity? It's inflammation. It's triggering of inflammation in your body so that your body can send out macrophage type 1 and then macrophage type 2 cells. Macrophage type 1 are the fire trucks to the fire. They're ringing the bell. There's a fire. Your body's trying to get immune cells to that area to start putting out the fire. But your macrophage type 2 are actually so that your body can repair it. And so there's two products that I love, that I love to put in conjunction when I have a CBC that I know people need it. One is CircuCore. Now, CircuCore has three things that are super important for vascular integrity and nitric oxide production: L-arginine and also, lost my train of thought, grapeseed extract in the form of activin. And then if you add the trifecta to it, the powerhouse of vitamin D in the form of D3 with omegas, anything like that, that trifecta is what's going to really help you produce nitric oxide, because nitric oxide is a gas. So when your cells heal, when your vascular system pulls together, there's a gas that's released called nitric oxide, and it helps keep the blood viscous, which means easily flowing. So when you're taking CircuCore, which has the L-arginine and it has the activin and all the other nutrients in there, plus there's some B vitamins and other things in there that really help the body utilize it well. And then you add a vitamin D to it, you have the perfect trifecta that's really going to help your body stay healthy cardiovascularly, circulatory system, even oxygenation. Okay, because nitric oxide is important for iron distribution. It's important for methylation. You can't segregate the body. The second thing that I like to use in conjunction is Natachem Plus. That is a systemic enzyme. It has a lot of natokinase, which we heard Dr. Peter McCullough talk about during the pandemic. And also it has serrapeptase. So natokinase is known and studied for eating the outside biofilms of things. So if you do have an immune system issue going on, which you do, natokinase is going to go in there and go after things that shouldn't be there. And also proteolytic enzyme therapy, which is what that's called when you're taking this type of enzyme and you take it on an empty stomach in between meals. Proteolytic enzyme therapy has been studied so much for all kinds of chronic issues and eating biofilms such as bacteria and viral biofilms. So you can look up those studies on PubMed. They're all over the place. SPMs, hands down, one of the best immune modulators out there, specialized pro-resolving mediators. These are fantastic. If you have any type of inflammation in your body, which is an immune system issue, again, put that into your brain that when you have inflammation in your body, it's immune system issue. Something is instigating your body, creating an immunological response. SBMs can be so wonderful for you. These specialized pro-resolving mediators will actually call to the area, and they're hydroxylated mediators. So they're basically specializing where your immune system should point and where those antibodies should go. But they also help with the, okay, stop, we're good. So they modulate the right amount of inflammation, and then they kick in the right amount of repair. So these are not just omegas. They're specialized pro-resolving mediators that come from omegas. But if we think about it, why would they come from good fats? Well, we just went back to cholesterol. Remember triglycerides and our second form of energy, which is fatty acids, because fatty acids bind to receptor sites and help modulate inflammation in the immune system. That's what they do. So it's really cool how the body works if you know how to connect all the dots and not segregate your health into like cardiovascular, brain health, gut health. There's no such thing. There's health in general. You are a whole functioning system that cross-talks to each system and function in the body in every single organ. So when you have a platelet count that's too high, you are at risk of clots and you want to modulate that. So CircuCore, Nattokin Plus, SPMs. I know I didn't put that on the list, but write it down. CircuCore, CircuCore, CircuCore. I really think everybody should be on CircuCore for a period of time just to ensure that their vascular integrity is good and their blood viscosity is wonderful. Okay, let's move down to white blood cell count differentials, which is neutrophils, lymphocytes, monocytes, and basophils. Scroll up just a tad, Phil. Up. The other way. There you go. No, you're good. All right, we're good right there. So neutrophils are going to tell me all about bacteria. Now, what kind of bacteria? I don't know. So we might have to ask more questions. I might ask you if you've been sick, if you've ever had exposure to Lyme disease, if you've ever had a streptococcus infection. As a kid, have you ever had a streptococcus infection? So one of the things I point out about methylation is, what is it, right? I've talked about it above and people are like, well, what is methylation? Well, it's your body's ability to methylate. And when your body can methylate, it creates these little methyl groups, these little kind of like bubbles, right, that float around your body. And they're looking for an amino acid to bind with. And I talked about in CircuCore, L-arginine being an amino acid that your body uses to repair vascular integrity, right, and make nitric oxide. Well, it needs a methyl group. That's why there's B vitamins in CircuCore, because those B vitamins help you create the right amount of methyl bodies to bind to the amino acid to repair your vascular system. So again, really cool how it works. So when we're talking about neutrophils, we're looking at bacteria, and your body needs to silence things that get activated, such as bacteria. It needs to methylate it and bind with something to silence it. What happened during the pandemic and or COVID, when people got this new infection or the jab, what happened was their body didn't have enough methyl groups available to silence that new infection or that new synthetic infection. And so it pulled a methyl group off of something that was already taken care of and silenced by your immune system. Well, my belief is, and what I've seen in my practice, is long haul COVID is a compilation of past infections that have become active again, a compilation of deficiencies because you just didn't have enough to overcome it, and a level of toxicity. So we do lots of things with my telehealth group when you come see one of the practitioners that work with me or me, where we take a look at your history. We take a look at past infections, past blood work. It matters to put new eyes on old testing. So neutrophils, bacteria, if your neutrophils are below 40, your immune system's repressed, and a repressed immune system is just as bad as an immune system that's overactive. We want to make sure that it's modulated correctly. I also look at neutrophils as gut health first. So my very first question to people would be, do you have any digestive issues? And I will ask about H. pylori, past, present. I'll ask about SIBO, that's small intestinal bacterial overgrowth. That's actually a candida imbalance and a probiotic imbalance in the gut. And what happens is there's bad opportunistic bacteria that works in synergy with our good bacteria to keep them challenged and strong. But those bad ones sometimes overgrow due to usually poor food choices or choices in general that we're doing. So our body never does anything wrong. It responds to the environment you put it in. So when I'm looking at gut health like this, I'm looking at, okay, what is the opportunistic bacteria that might be in there causing an issue? Or is this just a low microbiota type of thing? So I love Candy Kill because it has a plethora of really good antibacterial, antimicrobial, anti-parasitic, anti-mold, antifungal in the formulation. So it covers a wide variety of things. And just by taking that, you're just putting good nutrition in your body that's going to help the body go after these bacteria that you really don't want being more opportunistic than your good bacteria, which are your probiotics. I love IgG immunoglobulin powder mixed with GI Complete. Your immunoglobulin will go in there and just sop up things that shouldn't be there, help provide an environment for your good probiotics to flourish and grow. And then the GI Complete is just a powdered formulation. They have it in capsules too, but I prefer powders for the gut. That will help bring down systemic inflammation. It will help with repair of the digestive system lining due to the L-glutamine, another amino acid. So guess what you're going to need? You need that good methylation, that good B vitamins. And here's my little clinical pearl for practitioners out there or somebody that's been dealing with leaky gut for a very long time. All tissue, whether it's vascular tissue, gut lining tissue, the blood-brain barrier tissue, or your kidney vascular system, has endothelial tissue. And it requires all of the things to heal it and repair it in a nutrient-dense formula, according to studies, so that your body can seal it. And one of those things is L-arginine. The other one's vitamin D and activin. So if you take Circucor, which has those things in it, and your nitric oxide levels come up in your blood, your body can better utilize your L-glutamine. It can better utilize all of the things to seal and heal the digestive system. Not because the supplement is curing you, because it's not. It's because you're giving the body what it needs to fix itself. And that's the verbiage we have to start to take in. Me personally, I am not a healer. There was only one healer. He came, he went, and he saved us all. That was Jesus. But what I am is a path pointer and a map layer. And I know the nutrients that your body requires to heal itself. And so if I can point you in the right direction of what to take and how much and how often, that doesn't make me a healer. It makes me a detective, actually. So with that said, the more you learn about taking your health back, the better. And you can have more reliance on your own knowledge and wisdom than on mine. And if you need us, we're here. But my goal is to really teach you how to look at these tests. So lymphocytes, let me go back to neutrophils just for 1 second. So above 60, you're looking at something you need to address gut-wise. Below 40, you might say, well, what do I do if my immune system is low? Immunomax. Look at what the immune system needs, right? Vitamin C, vitamin D, vitamin A, vitamin E, vitamin K. Those are fat-soluble and one water-soluble vitamin that your body needs all the time. So things like Immunomax, which can really help tailor and boost the immune system, or Immune Boost, which is great to take on the daily. And, I think the dosage is around 5 capsules. You can take less or more depending on your own personal needs, or you can see somebody and get that tailored for you. But my point is, don't be afraid of nutrition. And if you see something going on that your immune system is a little bit low or it's not firing, you need to take action to help it get better and healthier. If you see it's too high, you need to take action to take out whatever the instigator is. And those are the formulations that I'm giving. So you can fill in next to that solutions column. Up at the top, there's the white blood cell count. I would just write in Immunomax, Immune Boost, and SPMs. And if you do those formulas, you're going to have a really strong, healthy immune system. All right, lymphocytes. Lymphocytes are all about viruses. What kind of viruses? I don't know. So I'm going to ask you more questions about, hey, do you get cold sores when you get sick? That's herpes virus. Have you ever had shingles? All herpes viruses are envelope viruses. SARS-CoV-2 was an envelope virus. That's why it responded really well to vitamin D, because vitamin D is the number one thing that fights envelope viruses. And what are envelope viruses? A virus in an envelope. So basically, it's like your body's mailing a virus to every single cell, and you want to stop that delivery. And so you stop it with vitamin D. And you can also stop it with L-lysine, which is an amino acid. You can take that in conjunction with your Circucor, so you balance your lysine and your arginine. But lymphocytes can also tell you about other herpes viruses, such as shingles zoster, that's herpes zoster, that's HHV9, also Epstein-Barr, which is another envelope virus, which we're going to talk about in monocytes, or just herpes in general. So if you are the type of person that actually breaks out in cold sores, under stress, or when you get sick, you might want to take a look at your lymphocytes. Again, when they're above 30, there's something underneath that's stimulating an immune system response that's going to cause systemic inflammation, an overall general malaise, and you're not going to feel great all the time. Or you might have flares. You get exposed to something and your body gets busy over here trying to take care of it, and all of a sudden you're sick and you're breaking out in cold sores. That's usually a sign that your immune system needs a little support. So I would be utilizing, again, Immunomax, maybe some vitamin D3, or that immune boost that has all of them in them. You can do IgG. And then if you look at monocytes, which it is what it says, this is the number one thing that people look at when you think you have mono. This shows me underlying what's called Epstein-Barr virus, which is what mono is. Now, is it high enough to be an instigator? Yes, if it's above 7. Is it diagnostic when it comes to going to a medical physician and he's like, well, it's not high enough? He's probably not going to say you have mono, but you'll have the same symptomology. And here's the thing about Epstein-Barr virus is that it has 4 phases or 4 generations of infection. So you have your initial infection, 6 months later, you can have another infection, and then you can flare at different times if you're exposed to other bacteria or viruses. So underlying Epstein-Barr is really, really crucial to take a look at. And anything over 7, I'm going to go after it. And I have here Live Clear. And you're probably like, why should I have Live Clear? Because it has everything that I need that's going to fight this particular type of envelope virus. So here's my thing. Taking a regimen, if you have 7 or above, 11 especially or above, this little regimen of L-lysine, NAC, zinc, or you can do the combination of the immune boost here with Live Clear, SPMs, and melatonin, you're going to feel really, really good because it's just going to help you modulate that. All right, last 2 things. Eosinophils and basophils tell me about parasitic issues in the body. Now, does that mean you have parasites and you're going to have tapeworms? No, I don't know. But it does mean that there's something that is parasitic in nature if it's above 3 for eosinophils or 1 or above for basophils. And so everybody can benefit from a parasite cleanse once or twice a year. Parakill is a great formulation that is a wide variety of different ages and stages of parasites. So there's different kinds of parasites. There are helminths, which can be worms, but there's also flagellas and flukes. People don't know that malaria transferred by a mosquito is a parasite. There's co-infections to Lyme disease that are parasites. Giardia in dirty water is a parasite. So we think parasites are third world country, but they're really not. We get exposed to them all the time. And if you have optimal digestion, which guys, if the top 4 prescribed medications in our country are digestive medications, we do not have optimal digestion, which is our first line of defense, our innate immune system against bacteria, viruses, and things like that. So keeping the gut healthy, very, very important. Your probiotics, superbiotics, frontier biotics, Saccharomyces boulardii, so important. But also putting in a regular parasite cleanse just to keep the microbiome happy and to get rid of parasitic, opportunistic microbiome or microbes or bacteria is really important. Microgon is a tincture, works great for kids. Like I said, if you want to put in the IgG and the GI Complete to bring down systemic inflammation, because it's not a matter of do you have leaky gut, it's how bad is it? So, and then basophils, the same thing. So really high level look with a kind of deep dive in for this last hour. So much more to learn for your blood work. At the bottom, I do have a few notes. Now, neutrophils to lymphocytes, bacteria to lymphocytes, where your ratios are 2-to-1 is where you want it. So 60-30, right? So we want it 2-to-1, 70-35. But if it's going to 1-to-1, where it's like 60-60 or 40-40, now you're looking at issues where your body's overexcited. And autoimmune doesn't necessarily mean that your body's killing itself. It's the body is so confused because so many cells are sick that it's killing everything, including cells that are infected. So we want to do all 3. We want to start with that candy kill, the IgG, the GI Complete, the SBC, and then we want to move into that parasite cleanse, and then we want to do that viral protocol and do it in phases. Month 1, month 2, month 3. If you need it tailored, how much, how often, see a practitioner. They can really help you. I gave you some conversions, absolute value divided by white blood cell count times 100. So who knew algebra would be that important? But hey, here we are. So that's going to give you a conversion if you have some wonky numbers that aren't in percentages, to just get you back to the percentage. So Phil, you can throw up the blood work class. Again, I know that was pretty speedy in an hour. I usually teach this over a couple hours. Hey, Joe. And if you
with
guys,
you, Tracey, is like a couple of hours with anybody else.
right. Well, that's what I hear.
In a good way.
Ask anyone.
That's right.
Having my shake.
Oh, did you guys like that or what? Huh? I mean, when have you ever seen such a thorough discussion about your blood work? Not from your doctor, right? No, and this is in a way that it's helpful that you can use, right? Now you know what your blood work really means. So this was great, Trace. It's
Thanks.
about time you came up with this one.
Well, it took a while. So
Yeah.
and it's a lot of things. And as I keep doing it, I keep learning and keep adding to it. And
Mhm.
I just want people to have real health freedom. That's the thing. If we can learn how to do things on our own to keep us out of the emergency room doors, you're going to be healthier for a longer period of time. And it's not that the medical system is not good. It's just not positioned right. It needs to be second or third choice, not always first. Unless your arm falls off, then your blood work's not going to help you at that point. But
No,
anyway,
you're right. But anyway, this presentation, folks, is we're taking this on the road. Dr. Tracey's been training physicians on this presentation now for the last couple of months, and we have a few more to go yet. So you are really reaping the benefits here, because this is something that we're charging doctors a lot of money to hear, and you're going to get it for free.
yep, there you go. Well, thanks for having me. If there's no questions,
Tracy, what if they want to learn more?
Do you mind if I jump in here real quick?
Jump in, Phil. You're the producer, director, cinematographer.
We did put Tracey's blood work course on nutritionalfrontiers.com under education. If you go to events, it's at the top of the page here under virtual courses. You just click on the link right here, and it'll take you to the course where you can purchase directly from there. The CBC with differential I'll print out for you guys today, so you don't have to go running for that. But when you sign up for the course, you get that as well, and all of her course materials too. So
there it is. All right, great. Well, Trace, awesome as usual, and we will be on the road again with us, and I'll get to see you in Clearwater in about a month.
Yes, I'm excited.
So save a swim for me on the
All
beach.
right, sounds good.
Thanks, Dr. Tracey Stroup, everybody.
Bye.